Okay, so today we're going to be assessing Lacey's nutrition status using the Nutrition Focus Physical Exam. So first we'll start with a general survey for the patient, asking them about their weight and their height and assessing that, and then asking any questions about if they've had a significant amount of weight loss over time, and then just noting general body movements like any shaking or rigidity, or if there's an absence of movement. So then, moving on to the head and neck portion, I would ask the patient to look at me straight on and close their eyes, and we'll focus on the temporal region. So right here on the temporal region, we'll focus to see if there's any hollowing or if there's a lack of muscle there. And then we'll move to the orbital region underneath the eyes. So you'll just be feeling right underneath the eyes to see if there is a fat pad there or if it's sunken in, or look for any discoloration or darkness underneath the eyes. Next we'll move to the nose, and for the nose region we'll just look for any scaling around the outside or any abnormalities or discoloration. And then with the mouth, I'll ask the patient just to open their mouth wide and take a look at their teeth, if there's any missing teeth, any dental decay, and then taking a look at the tongue to see if there's any discoloration or thrush. And finally, looking at the lips, we'll see if they're dry or cracked, or if there's any redness. And then the neck region, moving our way down, we'll look at whether there's any protrusions or any swelling of the thyroid or the parotid glands. So now, being done with the head and neck region, we'll just check the patient's hair to see if it's brittle or dry or thin, to see if there's any abnormalities there. And then while you're going through the head and the neck portion and throughout the rest of the exam, you're going to want to take a look at the skin color and the integrity, and just notice any difference in temperature, moisture, skin turgor, and then the texture. So the normal skin should be smooth and firm. And if they have poor skin turgor, it could be due to poor hydration. And that could be linked to different nutrient deficiencies. So moving on to the upper body, we're going to start with the clavicles. So so you would just take a look at the patient's clavicle and then kind of follow it up to their shoulder to see if it's protruding farther than it should be. Normally on women you'll be able to see the clavicle a little bit anyway, but just making sure that it's not protruding farther than it should be. The shoulders should be rounded and not square, so you should be able to feel the deltoid muscle and not be able to feel that the acromion is prominent. And then finally, moving to the hands, so it asks the patient to hold their hand up and make an OK sign. And so here we'll be looking for if there's any sign of muscle wasting in this area. So if there would be a deep V here and no muscle. And so if we had a malnourished patient, then it would show muscle wasting there. So along with the hands, we would take a look at the nails to look at the color of the nail, the thickness. They should be a pale pink. There should be no ridges on them and no discoloration. and not a spoon shape, because the spoon shape would signal iron deficiency. So finally, for the lower body, we would ask the patient to prop their leg up on the chair. And so with the quadriceps, you would just be feeling for that there is prominent muscle and that the bone isn't, there's not a line on the thigh that you won't be able to see the bone. And then the calves, you can do the same thing. So have the patient put their leg bent and feel around the calf area that they're that the muscle is prominent there as well. For the feet and ankles, you mainly just want to check for that there's no edema, so that you can't press your finger in and the skin stays put. You want to make sure there's no fluid or tension there. And then finally, for the respiratory portion, I would consult with the nurses and the other staff for the respiratory and the cardiac, but you could ask the patient to take a deep breath and then see if there's any abnormalities there, and just notice for different breathing sounds. For cardiac, you could listen to their pulse as well on their wrist, or work with a nurse and have them listen to their heart as well. And then for the abdomen portion, we're not gonna physically do it, but what you would do is have the patient lay down flat and let them know that you're gonna be feeling their abdomen for any abnormalities or any protruding organs or differences than what the normal should be like. So the first part would just be inspecting it and just taking an overall observation of what you see and what you hear, and observe the shape and the texture, and if there's any differences in color. Then for the palpation, you would assess the location, the size, temperature, things like that. And then finally, for percussion, you'll be making sure that there's no air bubbles. So you would take your hand on their stomach and put your thumb where their belly button is, so that your fingertips are just touching their stomach. And then you would take your finger on your other hand and tap your middle finger. And so there'll be different sounds like flatness, resonance, dullness, or tympany, and that will tell you if there's certain things that could be abnormal in their abdomen. And then you can also use a stethoscope to listen to the different sounds in their abdomen as well. For neurological, you could ask the patient to hold out their hand. And so you can just press your hand against theirs and ask the patient to push on yours. And so the pressure would tell you how well their motor skills are working for neurological. And then lastly, we talked about edema in the feet and the ankles, but you could also check other areas like their abdomen, their wrists, and once again their feet or ankles to see if there's any pitting edema or any fluid or tension there. And that is all that we have. Thank you.